Welcome to the Private Practice Survival Guide podcast with your host, Brandon Seigel. I'm a published author, speaker, entrepreneur, and private practice strategist dedicated to transforming the way that healthcare functions. This podcast is all about empowering you to create the change you want to see. Let's dive in. Welcome back to the Private Practice Survival Guide podcast. So thank you for tuning into this quick tip episode. Today, we're talking about most common private practice compliance blunders. You got it. I'm going to give you the breakdown. These are the things that are getting you locked up. As I always say, two things I'm afraid of, lawyers and the IRS, and I don't look good in orange because I got orange hair. So just as I want to keep myself compliant, I want to keep you compliant. So let's go. We're focusing on this topic because private practices face significant compliance risks. We've got 55% of financial penalties imposed by the Office of Civil Rights against small practices and most HIPAA breaches resulting from employee negligence. I want to say it again. Most HIPAA breaches are a direct result of employee negligence and non-compliance rather than external hacking. I think that's really important. And so I always say, guess what? Their mistake is your mistake. Their fraud is your fraud. Their breach is your breach. What are we going to do about it? So here are the 5 most common compliance blunders that I'm coming across. HIPAA privacy and security violations. You got it, I got it, etc. Let me tell you something. I don't believe that it is possible to be HIPAA protection perfect. So because we can't be perfect, we must always be improving. We must show improvement. We must show adoption of compliance regulations, and we must show that we are making every attempt to be perfect. So the numbers, the OCR closed 22 HIPAA investigations with financial penalties in 2024. Now they did more, but they closed. That doesn't talk about how many are open. Impermissible uses and disclosures of protected health information rank as the #1 most frequent violation, and the average cost of healthcare data breach rose to $9.42 million in 2021, with each HIPAA violation costing between $100 to $50,000 per patient record. PHI breaches have affected over 176 million patients. 176 million patients had their information breached. That's a crime, truly. So, here are the most common blunders within HIPAA. 1, unauthorized disclosure of patient information. 2, inadequate employee training on privacy protocols. 3, failure to provide patients timely access to their medical records. There is a 30-day requirement. 4, poor physical and technical safeguards. 5, missing or inadequate BAAs. So we need to implement comprehensive HIPAA training with annual refreshers. We need to establish clear policies for handling PHI. All formats, digital, paper, verbal. Conduct regular security risk assessments. Develop incident response procedures and use encryption in everything you do. Number 2, are you ready for the number 2 blunder? Billing and coding errors. Approximately 13% of every medical bill contains errors. 13% of every medical bill contains errors. Coding errors fall into broad categories of fraud and abuse, with abuse often resulting from innocent mistakes. So the most common billing blunders we're seeing upcoding services beyond what was actually performed, unbundling procedures that should be billed as a single code, inadequate documentation to support billed services, failure to verify patient eligibility and benefits, improper modifier usage. So when you call me and you say, "Hey, Brandon, can you help me?" And I say, "Yeah, what's going on?" I need a new medical billing company. I say, okay. I say, what's your pain point? I need someone to tell me what to code so that I make the most amount of money. And I say, we're not your practice. That's a upcoding compliance violation. Restate that again. The statement is, I need a billing company that understands what we do and can help us better understand codes and how those codes relate to medical necessity and the best way that we can optimize outcomes through compliant coding. Be aware. So, when we're looking to prevent billing and coding errors, we want to invest in certified coders with specialty specific experience. Stop hiring your receptionist to do your coding. Implement regular internal audits of billing practices. Use electronic health records with built in compliance checks. Establish clear documentation requirements for all the services. Regular training on CPT codes, updates, and ICD 10. So, something that's interesting, I meet these private practice owners and they say, hey, Brandon, I have a great billing in house. And I go, great. That's awesome. Who's your biller? Well, I just hired this like $15 an hour receptionist and she's great. And together we learned how to bill. And I go, well, let's reframe that. I said, if I was Medicaid right now, do you think you'd pass an audit? And you say, I don't know. I say, do you know what NCCI edits just changed? Nope. I say, do you know if your documentation's correct? Nope. All I know is claims are getting paid. And I say, well, how many retractions? I don't know. I don't follow that. I go, so you've learned how to submit a claim and you've learned how to get paid by a claim, but you have not learned if you can audit a claim. And you have not learned even if your coding is correct because you have not taken the necessity to learn that. And I say it this way, if I go out and I say, guess what? I'm working out and I've made an impact on myself and now I can be a personal trainer. No, personal trainers take scientific training. They understand not just the utilization, but the way different bodies work. Stop thinking that you can fake it until you make it because compliance is going to catch up with you. Plain and simple. So the numbers show approximately 100,000, or sorry, let me bring this out. When we're investing, though, in our process, we want both external and internal audits for our billing and coding errors. So the third most compliance blunder is inadequate risk management and patient safety. We are seeing over 100,000 people die each year in the US due to medical errors with an annual cost of $20 billion to the healthcare industry. This is preventable harm and medical errors are costing 17 billion to 29 billion per year is what they're showing. So we need to make sure that we are taking care of patient safety. Medication errors and administrative mistakes are part of this. Failure to follow proper patient identification protocols, inadequate infection control, poor communication during patient handoffs, and insufficient monitoring of high-risk patients. We are running into major challenges right now because we are so motivated to discharge based on CMS guidelines that we are putting patients at risk. And so as you look at prevention strategies, I want you to implement standardized safety protocols and checklists. I want you to use electronic prescribing systems. I want you to establish clear communication procedures between your staff. I want you to have safety training and incident reporting systems and conduct patient safety rounds, case reviews, etc. The fourth blunder, employment law violations. Woo! This is the one you suck at. I'm sorry. 1 out of 5 practices that I come to, I smell an employment law violation. I can smell it. I don't even have to see it. So the numbers, 25% of organizations estimated that more than 50% of their income is spent on compliance costs because of violations. Workplace violations are resulting in fines, and it's going up by the day. What are the most common employment blunders? Sexual harassment policy violations, OSHA workplace safety and standard breaches, inadequate employee training documentation, discrimination in the workplace, failure to maintain employee records, and misclassification. Stop being lazy. Let's follow the rules. So, We need to develop comprehensive employee handbooks with clear policies. We need to conduct regular harassment prevention training. We need to implement proper safety protocols and equipment. We need to maintain detailed training and incident documentation, and we must have policy reviews regularly. So the last one we're going to focus on today is inadequate compliance program infrastructure. 31% of surveyed respondents predicted their compliance teams will expand in the next 12 months. Regular compliance audits save an average of $2.86 million on these hospitals. It is so important. So, most common blunders: no designated compliance officer, outdated or non existent policies, lack of regular monitoring, poor reporting mechanisms, and insufficient corrective action procedures. We have to designate a compliance officer. We need to establish written policies and monitor it regularly. We must have internal and external audits, creating anonymous reporting channels for compliance concerns, and develop corrective action plans for identified issues. One of the things that we have in our exit interviews is one of the questions is, during your time of employment, have you seen any compliance violations that we should be aware of that you have not previously reported? So the financial impact: HIPAA penalties are ranging from $100 to $25,000, depending on the category. We've got indirect costs, lost productivity, reputation damages, legal fees, credit monitoring services affecting our patients, staff retention, and systems. The stuff is happening. And so implement the 7 core compliance elements. This is from the OIG: written policies and procedures, designated compliance officer, regular training and education, effective communication channels, internal monitoring and auditing, disciplinary standards, and corrective action procedures. Get those 7 in place and you'll be humming along. So, as we look at the different compliance priorities, I want you to recognize 60% of risk and compliance professionals indicate cybersecurity as a planned training topic. You got to enhance your third-party vendor management, and we have to increase emphasis on making sure we're even aware of how we utilize AI, and if AI adoption or scribing or anything like that is breaching HIPAA. So we must have stricter enforcement as we look forward. So MGMA says that 58% of private practices fail to maintain accurate and timely patient billing documentation. That resulted in 30% higher rate of claim denials and potential fraud allegations. It's there, everyone. I'm telling you. So this was inspired by Carol Dweck. Compliance mistakes are lessons in disguise. Correct them with courage and commitment, and you'll forge a stronger, more trusted business. Thank you so much for tuning into this quick tips episode of the Private Practice Survival Guide podcast. Don't forget, together we can thrive, not just survive. Thank you for tuning in to the Private Practice Survival Guide podcast. I'm incredibly grateful to each and every one of you. Exciting news. We're now available everywhere, from Spotify to Apple Podcasts to YouTube or anywhere you like to listen to your podcasts. So watch, listen, and reach out. If you love this episode, please drop a 5-star review. It truly means the world to me. Are you looking for more ways to elevate your practice? If so, now is your chance. Reach out, go to my website, or email me at brandon@wellnessworksmp.com. And remember, it's not just about surviving, it's about thriving.